afternoon, everyone, and thank you so much for joining us today. I'm Jenny Dodson, and I am the Associate Director for the Healthcare Reform Center and Policy Institute, and I am thrilled to be able to bring you another Certified Healthcare Reform Specialist update. I just wanted to run through some quick housekeeping notes about today's presentation, and then we'll jump right into it. As you know, chances for an IRS audit are definitely inevitable, and the Certified Healthcare Reform Specialist Program is here to help our participants understand what those audits are and understand, how to prepare for them. And the Healthcare Reform Center and Policy Institute is a nonprofit public policy organization, a think tank, if you will, of individuals who've come together to work together, collaborate on content, and bring you information so you can better prepare. This Certified Healthcare Reform Specialist Program is designed, as you know, for brokers, agents, consultants, as well as human resource managers and C-suites that are looking to understand the legalities of the ACA and understand what they have to do to implement the various mandate opportunities into their portfolio, or how to advise an employer of what to do with that. So we bring you these updates. For those of you that are students, you will have the opportunity to view this presentation that we're about to start in the Learning Management tool as continuing education. This is core content that will be uploaded moving forward for our new specialists that are coming on board. It's very important information on strategically communicating with employers, as well as IRS forms, how to fill them out, what the nuances are about them, and we'll go into more detail. So without further ado, I'd like to welcome everyone again. Today we have Ben Connolly with Safar Shah, and he's an attorney, an employee benefits attorney. He's done hundreds of presentations on the ACA, and he is a founding faculty for the Certified Healthcare Reform Specialist Program. We will have the opportunity to take questions after the presentation, and you can populate those questions through our Learning Management tool, and you'll see the question and answer. Please populate your questions as you see them as they come up, and I'll moderate those questions at the end of this presentation. And without further ado, I'd like to hand this over to Ben Connolly, again, employee benefits attorney with Safar Shah and faculty for the Healthcare Reform Center and Policy Institute.
What we're talking about today is some of the communication strategies that are included in healthcare reform, or some of the communication requirements that are included in healthcare reform, as well as strategies for dealing with those requirements. Now, I know that what the folks on the phone likely may have interest in are the new reporting obligations under the Employer Mandate Code Section 6056, specifically Forms 1094C and 1095C. And we are going to talk about those in quite a bit of additional detail. So I'm going to go over everything. I'm going to spend a little less time on some of the earlier material that might already be in effect, and a little more time on those reporting obligations, because I know that those may be at the forefront of folks' mind on the phone. Now, happy to talk about any of those things in greater detail, so please let me know to the extent you want me to focus on those more greatly, to a greater extent. All right. The takeaway that I think is important from this presentation is that without a doubt, there are a lot of new communication requirements connected to healthcare reform, and you simply can't really get around those. But what we kind of suggest that folks do is that if you have this requirement or this obligation to do this reporting, it may make sense to take advantage of that obligation. And even though you may not be required to do this, communicate to employees in an effective way that you're providing them with a very valuable benefit, that being health insurance, and that is a differentiator perhaps between you and others in the employment space. Because again, if you're going to be forced into offering health insurance, maybe you don't feel like you're being forced, of course, maybe you want to anyway, but if you are of the camp that doesn't want to offer health insurance, but you don't really have a choice now, take advantage of it. And effectively convey to employees that what you're doing is offering them a very valuable benefit that they might not otherwise be aware of. With that in mind, let's talk about some of the specific requirements that come into play under healthcare reform. I guess one of the things I would say before I jump into that is of course, there are a number of different approaches to dealing with the employer mandate. And a lot of people have said when this law commenced, well, I think everybody's just going to drop coverage and shift their employees to the exchanges. We haven't really seen that happen to date. So if you are taking that approach, not suggesting that there's any right or wrong to that or placing any value judgment with that, but just realize that you might not be in the mainstream in terms of your approach to this law based on, putting aside anecdotal evidence, looking to the actual statistics of what employers are doing. So that might change over time, without a doubt, but for the time being, employers seem to be approaching this with a play mentality rather than a pay mentality. So again, jumping right in, there are a number of required notices that were included in healthcare reform, and I'm going to highlight a lot of these which have been in effect historically without lingering on them too long. But the first of those would be the requirement to notify employees if your plan previously imposed a lifetime limit and that lifetime limit has been removed. Now, theoretically, if you were doing this, this limit would have been removed years ago, back in 2010 or back in 2011, I guess, when the obligation to remove lifetime and annual dollar limits originally went into effect. But at that time, you were required to notify folks who were previously kicked out. The DOL and provided some model language that you could use to facilitate that election. But hopefully that's already taken place, so it's not something you need to worry about at this point. Again, something that might be becoming more of a relic of the past. To the extent that your plan has remained grandfathered, you are required to communicate that to participants in any participant communication materials that substantively describe your benefits. So just as a refresher for those folks on the phone, a grandfathered plan is one that has been in effect since September 23rd, 2010. And in the interim, there have not been any significant cost shifting from the plan sponsor to the participants. In other sessions, we do discuss the specifics about what it means to lose grandfathered status, but what I'll say for these purposes, I guess, is that most plans, to my knowledge, have lost grandfathered status by this point. There are very few plans that we come across on a day-to-day basis that remain grandfathered, but those that are still grandfathered are required to include a notice of the plan's grandfathered status in participant communication materials. Again, there is a model notice out there that's been made available by the DOL. The language in the model notice isn't ideal, but if you've been provided a model notice, our initial recommendation is always to adhere to that model notice unless the language in the model notice is just completely intolerable, in which case you can play with it on the margins, but at the end of the day, you cannot substantially change that notice. So just be cautious in that regard. Another requirement under healthcare reform was the requirement to report to employees on Form W-2 the value of health insurance provided. Now, there's a lot of speculation surrounding why this requirement exists and what the background is and why the IRS would ever ask for this, but the speculation at least is that this is going to be used to facilitate the Cadillac tax once it goes into effect in 2018. The reporting requirement relates to the value of health insurance coverage provided, and the Cadillac tax is linked to the value of health insurance coverage provided. There are some disconnects between what's on the W-2 and what the IRS is suggesting will be required for purposes of calculating Cadillac tax. So we expect that those disconnects will be addressed prior to 2018 so that this can all be one smooth reporting piece. But for the time being, the administration has stated that the reason behind this W-2 reporting requirement is really employee awareness. In other words, just back to our initial discussion about taking advantage of the opportunity to communicate to participants about the value of the benefits you're offering. And in that vein, most employees don't know how much their health insurance is actually worth. They see their portion, which is usually just the tip of the iceberg, 20, 15% of the overall cost that the employer is paying for that benefit. And they don't realize that health insurance coverage is actually a significant component of their overall benefit package. So what the administration says is that if we put this amount on the W-2, that lets people know that, and it lets them know sort of how much the cost of their coverage is, and hopefully it incentivizes better health decisions. I don't know that we've seen that yet, but, it is what it is. So typically, for W-2 reporting purposes, this is a requirement that went into effect back in 2012 to be reported initially in January of 2013. Again, looking back to the 2012 plan year. It has been and remains optional for small employers, which for these purposes is defined as an employer with fewer than 250 employees. Again, for the time being, these benefits are not taxable. The reporting obligation is solely informational. When you're reporting these amounts, what you're typically reporting is any group health plan benefit that is not an accepted benefit. So that usually includes medical. It could include dental and vision, although dental and vision is moving more and more towards a situation where that's always going to be an accepted benefit. Not uniformly the case, but in most circumstances. And then in very rare events, you would also be required to report employer contributions to a flexible spending account. For these purposes, though, what you would exclude would be any accepted benefit and health reimbursement arrangement contributions or credits, even though health reimbursement arrangement credits are typically considered a group health plan. For purposes of time today, I'm not going to get into too much detail about FSA reporting. Just know that typically, in 97% of the circumstances, FSA contributions, either employee or employer contributions, would not be reported on the W-2. The rare instance when participant contributions might be reported are the circumstance where there are employer flex credits contributed to the FSA, and it doesn't consist solely of employee deferrals, salary deferrals, and where that employee put all their flex credits into the FSA, but likely opted out of all other benefits under the cafeteria plan. So they didn't elect medical, dental, vision, et cetera. All they did was take all those flex credits and dump them into their FSA. I'm not describing that in a very scientific manner, but it arises so infrequently that I'm not going to linger on how that calculation is done. But it's all sort of outlined up on the screen here. And essentially, it's you're reporting if the FSA contributions exceed the total benefit election across the board. If that happens, the only amount you're reporting is the employer contribution to the FSA, excluding any employee portion contributed to that FSA. So again, that's the piece that would be rolled into the overall dollar value. So what you're reporting there on box 12 is everything that's subject to the reporting bundled into $1 figure. So it would be medical plus, any bundled dental and vision to the extent that's applicable, plus this rare event FSA employer contributions. But again, I don't see that coming up a lot. In the years I've been doing this, seeing hundreds of clients about it, I only ever saw one instance when a client had to report those amounts. Other types of benefits may very well be considered group health plan coverage that needs to be reported. Those might include EAPs, wellness programs, and on-site clinics. Typically, though, even if that benefit is considered a group health plan benefit, you would only need to report that benefit on the W-2 to the extent the benefit is subject to COBRA, which most group health benefits typically are, and you assess a COBRA premium for that benefit. Now, realistically, what usually happens here is that even though the benefit might be subject to COBRA, employers don't treat it as subject to COBRA. And you might understand why. For instance, if you have an on-site clinic and it is subject to COBRA, one of the things you might want to avoid is a disgruntled former employee returning to your premises to receive medical services for understandable reasons. So a lot of employers just say, well, we'll accept the risk that we're not offering COBRA for that benefit. We just don't want that to happen. For W-2 reporting benefits purposes, They are, though, taking the position that this is perhaps a COBRA eligible benefit, but they're simply not charging employees for it, and it's available, but nobody takes advantage of it. It's not really what's happening, but that's the position they take. But if that is the position that they take because they're not charging a COBRA premium for that benefit, it would not be reported on the W-2. Post-termination reporting is typically optional in years following the year to which the year of the termination. The exception would be if you have a retiree who is otherwise entitled to a W-2 for whatever reason. In that event, you would report the value of that retiree coverage in the year following termination in a subsequent year. What I have on the screen here in very, very tiny font is simply a reference material that you can find at the IRS website. So if you just Google IRS Affordable Care Act tax provisions, they have a whole page devoted to all the, hundreds of thousands of pages of guidance that they've issued on various Affordable Care Act related topics. The regulations are there if you want to read through them. If you want to leave that for the lawyers who love doing that thing, that type of thing, which may or may not be me. There are also just helpful guides for that are written sort of in an easy to understand manner, and charts and things like that. So what I've got up on the screen here is an easy to understand, quick reference chart that the IRS has on their website telling you for various types of benefits whether you should report it or not report it. So if you're struggling with this, I encourage you to go out to the website and check this out. So there you go. I mean, that's W-2 reporting in a nutshell. It's been in effect for a while. One of the questions we get a lot is, oh, we forgot to report on the W-2, or we reported the wrong amount on the W-2. Do we go back and fix that now? Arguably, yes, you would, but from a practical standpoint, perhaps the cost of doing so exceeds the risks that you face for failing to do so. I mean, again, for the time being, this is not taxable. It's just informational. So fixing the report won't trigger any tax liability, or reporting the wrong amount is not excluding any amounts from the IRS's reach that would otherwise be subject to the IRS taxation rules. It's just informational. So technically, you're required to issue a W-2, and it needs to have the correct information on it. And if it doesn't, you're technically under an obligation to correct it. But I'm not going to say that there's never been an employer that's chosen not to do that. Okay, there are a few other notice requirements that are out there, and we're just flipping through them really quickly at this point. The first is an exchange notice. This was a new requirement that was mandated under the change to the FLSA that would outline to employees, both benefits eligible and non-benefits eligible employees, the existence of the health insurance exchanges and the availability of coverage through those exchanges. I think this was initially required back in late 2013, right when the exchanges were at least intended to roll out, and it continues to be an ongoing obligation that this be provided to new employees. There is no direct penalty linked to failure to provide this notice, though, for what it's worth. There is also a notice that is required in advance of any rescission of coverage. So the ACA generally prohibits rescissions. The exceptions to that rule would be if there is an intentional misrepresentation of a material fact or fraud on the part of the participant, in which case you can rescind coverage, which means canceling coverage retroactively. But before you do so, you have to notify participants at least 30 days in advance to give them the right to appeal that decision that's coming down the pipeline. Separately, for non-grandfather plans, if there is a requirement that participants designate a primary care provider, the plan must notify participants that they have the right to designate any available primary care provider within the network. If there's a requirement for referrals, you must notify participants that they can seek OBGYN services without a prior referral. And you must notify participants that for children, they have the right to designate a pediatrician as their child's primary care provider. Those are narrow circumstances and usually only applies in the context where the plan has a primary care provider, like an HMO or an EPO type setting. Finally, the Affordable Care Act really shook up the claims and appeals requirements. and specifically changed the way that, or the information that needs to be included in an explanation of benefits or claim or appeal denial. So specifically, there are a number of new denial and treatment code references that need to be included on those notices. Culturally and linguistically appropriate, there must also be a notice included on the claims denial in certain circumstances that informs participants of the right to receive that notice in a culturally and linguistically appropriate manner. That would only apply if the participant lives in a county where more than 10% of the population speaks a non-English language as their primary language. So Spanish is the big disclaimer you see on there. We see a lot of people just put the one-liner right to receive a foreign language notice on their EOBs just to be safe. Another important one here that I think gets missed a lot, especially in the union context, and that relates to the new summary of benefits and coverage requirements, which we'll talk about in a second. But generally, participants are now required to be provided with a new summary of their benefits, a short 4-page summary of benefits and coverage, as it's called. And the way that this works is it's essentially a uniform notice distributed nationwide that informs participants at a high level about their coverage. Generally, this has to be provided every open enrollment, and then if there is a mid-year change that would alter the information in a material manner that is included on the SBC, you have to provide 60 days notice before that change goes into effect. So essentially, you give them the SBC at the start of the year. If anything changes mid-year, you give them a new SBC 60 days in advance telling them what that change would be. That's only for mid-year changes. I think there's a broad misconception that this is now a 60-day advance notice requirement for any benefit plan changes. Only mid-year changes, only those that would materially impact the information included on the SBC. All right. Speaking of the SBC, this has been around now for a couple of years. It actually was changed a little bit due to based on proposed regulations that came out late last year. And actually, I think the DOL just issued a notice within the last like 30 days that said we'll be finalizing those rules soon. So it was sort of a notice that didn't do anything other than let people know that that's coming down the pipeline. But we kind of already knew that anyway. I already talked about the SBC and what it is and what it does. I don't think I'm going to linger on the SBC too long because I do want to devote a little bit more time to the new employer reporting obligations. But beware that this is out there, applies to any group health plan. The SBC will be changing pretty significantly this year, probably in the next year. So if you ironed out your SBCs in 2012 and have been issuing them no problem ever since, just be aware that you're going to have to revisit it likely for next year's open enrollment and update them to meet the new model format. Here's a glimpse of what it looks like presently, although they have issued new model templates that are significantly shorter. They actually add a new coverage example telling people how their health plan works in the event of certain common medical occurrences. But they strip out a lot of other information that they deemed to be not really helpful to participants. And so this is going to be a little bit shorter going forward. But again, just when you think you get the SBC figured out, beware that it is changing this year. And as a result, plans will need to revisit and update those SBCs that they finalized previously. All right. The core of the presentation, what I want to spend a lot of our remaining time focused on is the new reporting requirements under the employer mandate. So let me run through some surface background information first. The Affordable Care Act created an employer mandate that requires that employers provide coverage or pay a penalty. It also created health insurance exchanges that provide a new avenue for employees to get health insurance coverage and include a new premium tax credit for individuals who don't otherwise have disqualifying coverage, for instance, through their employer, to help them pay for that coverage to the exchanges. Eligibility for a tax credit in the exchanges is directly linked to what your employer does and whether you're employed. Also, the Affordable Care Act created an individual mandate. the individual mandate is an obligation for individuals to obtain coverage or pay a penalty. Your liability under the individual mandate can also be linked to whether your employer offered you coverage, whether you enrolled in that coverage, whether you enrolled in exchange coverage, etc. So this is all interrelated, right? But with all these new requirements and tax credits and tax penalties, the IRS needs to know what happened in 14, 15, 16, and so on. And what they need, in fact, is a snapshot of what happened in every single month. Because the way that these penalties and tax credits all work is that your eligibility for a tax credit or your avoidance of a penalty is linked to what you did in each month. And if you were out of compliance in January, you might be subject to a penalty in January, but you can come back into compliance in February and avoid a penalty then in February. So that's the way it works. And for the IRS to facilitate these informational intake process, they created the ACA created two new tax code sections, Section 6055 and 6056. Section 6055 mandates that anybody who offered health insurance, be it an insurer, an exchange, an employer, self-funded plan, report to the IRS who was enrolled in that coverage and in what months, because your enrollment in minimum essential coverage impacts your liability on the individual mandate and your eligibility for a tax credit on the exchanges. That's governed by Code Section 6055, and it's a mandate to providers of insurance to tell the IRS who was enrolled. To facilitate that reporting, the IRS created two forms that are similar to the Form W-2, but they are called the Form 1094B and 1095B. So, new Code Section 6055 mandates reporting using Forms 1094B and 1095B. Separately, to facilitate the employer mandate, the ACA created Code Section 6056. 6056 is an obligation that any large employer report to the IRS who was full-time in any given month, whether they were offered coverage and what that coverage looked like. Again, that's mandated by new Code Section 6056, and the reports are issued by employers using IRS Forms 1094C and 1095C. So 6055 and 6056 are the code sections. Those requirements are carried out using Forms 1094B, 1095B under 6055, 1094C, 1095C under 6056. So 6055 mandates reporting on what is known as the B series because it's the forms with the B in it. 6056 is facilitated using the C series because it's the forms with the C in it. The way that these reports work is very similar to W-2 reporting. When you are reporting using a Form W-2 every year, you issue W-2s to the employees, and then you issue a mirror copy of that W-2 to the IRS. You, as an employer, complete an aggregate transmittal form known as the W-3, I think. I always say that, but I might be wrong on that. The W-3, which sort of sits on top of your pile of W-2s, and that all goes to the IRS. You have one W-3 saying, this is John Smith Widget Company, and then 250 plus W-2s saying, here are all the employees who worked for us, and here's how much they got paid. That whole stack goes to the IRS. And then each employee gets their W-2 saying what they specifically made. These reports work the same way. The 1094 in each circumstance is the aggregate report, so similar to the W-3. It's one report that sits on top of your pile and goes to the IRS and says, here's my pile. The 1095s, either the B or the C, work like the W-2. There is one per employee who's covered by that report, and one copy goes to the IRS and one copy goes to the employee. The timing is also exactly like the W-2. So the report that goes to the employee, the 1095 report that goes to the employee, has to go to the employee by the January 31st, that is the January 31st following the year to which it relates. So these reports are initially due for 2015, and they are due to employees by the January 31st following the close of 2015. Actually, January 31st falls on I think it's on a Saturday. Scrolling through my calendar to confirm that. It's on a Sunday, so these forms are actually due by February 1st, which is the Monday following. But typically, in any given year, they're due by January 31st. Then, recall that you also have to get to the forms to the IRS. If you are a paper filer, which is generally folks who opt to do paper filing and have less than 250 forms they have to issue, those are due to the IRS by February 28th of the year following the year to which it relates, so February 28th, 2016. If you're an electronic filer, which is if you choose to file electronically, and if you have more than 250 forms to submit, you have to file electronically, then the forms are due by the end of March of the year following the year to which they relate. So for most employers who are subject to electronic filing, that means you have to get the report to the employees by January 31st, or this year, February 1st, and then to the IRS by the end of March. So your 1095 is going to the employee, then a mirror 1095 and the 1094 is going to the IRS. That's sort of the format and the structure surrounding how these forms work. All right. Again, I already talked about this, but the 6055 report is primarily for anybody who is required to issue, or anybody who is issuing health insurance, be it an insurer, sponsor of a self-funded plan, a government provider of health insurance, any issuer of individual or group insurance policies. All of those folks are required to issue a report under 6055, which again would be the B series, the 1094B and the 1095B. This report primarily transmits to the IRS. By the way, we're not going to focus too much on the B series today. It's absolutely relevant for health insurers and for small employers with self-funded plans, meaning less than 50 covered lives generally. But for almost everybody else, for most employer group plans, they're going to be worried about the reports under 6056, so the C series reports. But for these purposes, the 6055 report, 1094B and 1095B, report to the IRS pretty much any information they need to determine who was enrolled in those minimum essential coverage plans every month. So it's information about the employee, address about the address for the employee, etc. Information about the provider of that coverage, information about people covered as dependents under that coverage, and then a breakdown of which month those individuals were enrolled in that coverage. Because again, your liability under this law can vary by month. You know, and this is a sample of how that looks. The forms are actually out, so you can pull them up and look at them. This is a simplified PowerPoint sample of how that report would look. You know, I encourage you, if you are subject to the B series reporting, to pull this up and look at it. And we talked about the time frame for delivering these, so I'm not going to linger on that piece either. The 6056 report, again, is the one that is a bit more complicated and probably going to hit most of the folks on the phone. The 6056 report is required by any large employer. Now, that means generally, and we have a whole other segment that is on the employer mandate, but generally the 6056 would apply for any employer with 50 or more full-time equivalent employees in their control group. So to be clear, you are subject to the 6056 reporting if you are in a control group, and within that control group there are 50 or more full-time equivalent employees. Now you might say, well then, you're wrong on that because there's actually transition relief, and for 2015 alone, large employer is 100 or more full-time equivalent employees. That's correct, and it's also incorrect all at the same time. What I mean by that is the obligation to offer coverage is delayed for a year for employers with between 50 and 99 full-time equivalent employees. But the reporting requirement is not delayed. And what I mean by that is if you are between 50 and 99, even though you don't have to offer coverage, you have to tell the IRS what you did in 2015. So, you know, a lot of folks have sort of been sitting with their head in the sand between 50 and 99 and saying, we're going to put this decision off until next year. But at the very least, you need to be ready to issue these reports by the end of the year. And by the way, a separate report is required for each member of the control group. So if you're a member of a control group of corporations where you have some parent company that has historically handled the W-2 reporting for you, that's fine, and you can get the parent company to handle these reports for you as well, but the obligation directly runs to you, and all of the liability runs directly to you. So You might feel comfortable that your parent company is going to handle this for you, but you need to be pretty darn sure that they are taking care of that for you. I'll show you what's going to go on these reports in just a second, but generally it's any information the IRS needs to determine whether the employer is subject to the employer mandate. Now, one welcome reprieve is that a lot of employers said, well, look, I'm a sponsor of a self-funded plan, and I'm a large employer subject to the employer mandate. Do I really have to do the B series to show who was in my plans and the C series to show why I complied with the employer mandate? And the answer is no. The IRS created a combined report 1095-C form that you can use. And the way that it works is if you're an employer who's a large employer and also self-insured, you can report all that information on one form. So what this includes is information both to determine your compliance with the employer mandate and information to demonstrate to the IRS who had enrolled in your self-funded plan. Now, if you are a large employer who has a fully insured plan, you're still submitting the 1095-C, but you're leaving that section relating to who was enrolled in that coverage blank, and that's handled by the insurer separately. So it's bifurcated reporting. You only have to worry about your employer mandate portion. I'm going to skip this because we've got the actual forms up here coming up in a second. There are a few simplified reporting methods. I think I'm going to talk about that once we get there and talk about how that works. I think I just want to jump into the form here to show you how this works. Generally, as with W-2s, when you're issuing these reports to employees, you're required the safe harbor is to deliver them via first-class mail, but you can get employees to consent to receive the forms electronically, and then you can distribute them electronically. But the consent rules are slightly different than what you see in the DOL electronic distribution safe harbor. So, same rules, though, that apply in the W-2 context. So whatever you did for the W-2 to get consent, you can do the same thing here. There are penalties for failure to report, and those penalties are pretty much consistent with the penalties for failure to report W-2s. Generally, inadvertent errors can trigger liability of up to $100 per report. So if you try to fill this out correctly, but you screw up or you're a couple days late, the penalty can be up to $100 per failure. But if you intentionally fail to report, the penalty can go much higher, and I think it's something like $250 per intentional failure. And I think that there might be no upside cap on that. Again, I chased this down the other day, but if you find yourself in a situation where you choose to intentionally not report, you might want to chase that down and find out the exact amount of your liability and what that would be. Hopefully, you're not in that circumstance and you're making an effort to comply. Okay. So I want to pull up the forms and actually show you what these look like and walk through some of the elements that are included in here. We're focused now on the C series. So, the B series are a bit more straightforward. I don't want to say it's a walk in the park, but it is a bit more straightforward. If you're an insurer or a self-funded employer who's not subject to the employer mandate because you have less than 50 employees, then you're going to want to chase those forms down as well. But again, if you're a large employer at all, you're going to have to submit these C series forms, so that's what we're going to focus on. So 1094 and 1095, right? They're both a little complicated, but the 1094 is a little easier. The 1094-C is the aggregate report, the aggregate transmittal report that would sit on top of all of your 1095-Cs and go in a bundle together to the IRS. This one doesn't go to the employees. It only goes to the IRS because what you're telling them is aggregate information, which arguably isn't really relevant to the rest of your employees. So the first part, hopefully, is easy. It's just information about your company. Now, what I think I would stress here is focus on that applicable large employer member, which is a lot of jargon, but what it really means is that each EIN, essentially within your controlled group, has to separately complete one of these reports. It's not one for the entire corporate family. It's each separate EIN. Now, if you've got like Bob's Pet Store and you have 2 locations, that's probably under the same EIN, and you can just submit one of these for both of those. So it's not like who's in your 4 walls, but it is divvied up more than just your entire control group of corporations. So the other thing the IRS says is that you can do this piecemeal. So let's say you have Bob's fish store, pet store, I guess is what I said, and you've got two different locations and you've got somebody handling payroll at both locations. If you're within the same EIN, you can have each entity do their own set and issue their own 1094-C, but you always do have to have one aggregate transmittal, one form that controls for everybody. And that's when you get down into Part 2 and it says this is the authoritative transmittal. That one aggregate form you're submitting would be applicable, and you would check that here. Then obviously you fill out the box saying how many 1095-Cs you submitted. Generally, you're required to submit a 1095-C for any employee who is a full-time employee for any month during the calendar year. So part-timers who are part-timers all year long, you don't have to submit one of these, but if they were a full-timer for any month of the calendar year, you do have to submit a 1095-C. Also, for self-insured employers, even if an individual was not a full-time employee, if they were enrolled in your plan, you still have to submit a 1095-C. You can separately submit a 1095-B, but my perspective or my take on this has always been, if you're already doing the C-Series for everybody else, why not just do those folks on the C-Series as well, rather than creating more headaches? So that's going to be a report indicating total number of forms, which includes any person who was a full-time employee at any point during the year, then any non-full-time employee who was enrolled in your health coverage at any point during the year. Aggregated group indicator, again, if you're part of a control group, you would click yes here, and then complete Part 4, which essentially lists everybody in your group. The next piece, which is a bit tricky, is the transition relief rules. So what I would say here is that Part C is probably pretty significant, but the rest of them, it sounds great, but it's not quite as great as you might otherwise think. So let's start with Part C and then work back from there. Part C, you would click Part C if you are an employer who's between 50 and 99 full-time equivalent employees. If you're subject to reporting, but you're not subject to liability for failure to provide coverage. That's one big exemption. So if you're submitting this report, but you didn't offer coverage to anybody, make sure you check that box. This would also apply if you're in a non-calendar year plan and you qualify for a delayed effective date. Now, I just want to be clear, because I was on the phone with somebody about this the other day. Having a non-calendar year plan year does not, in and of itself, entitle you to delayed effective date. You have to jump through a number of additional hoops, including looking back to the coverage you offered in 2012 and making sure that coverage was offered to a broad enough portion of your population in order to qualify for this delay. So if you didn't historically offer coverage, but you have an off-calendar year plan year, and you think you're entitled to this relief, you better verify that, because you might be 3 months into penalties, 4 months in now at this point, without even knowing it. That's box C here on line 22, section 4980H, transition relief. Let's go on now to the part, line D, which again is somewhat relief, but not the best relief you can get. Part D, the 98% offer method would apply if you offer minimum value, affordable coverage using any of the affordability safe harbors to at least 98% of your full-time employees. Now, you probably have to figure out who your full-time employees are to figure out whether you qualify for this relief, but this probably applies to organizations that have a by and large full-time workforce and that offer coverage to most of them, or an organization that offers coverage to anybody who's like, let's say, 20 hours per week or more. You might qualify for this transition relief. Now, this doesn't exempt you from reporting. You still have to issue a 1095-C to every full-time employee. So what you're essentially doing there is over-reporting rather than under-reporting. The benefit of this, clicking this box, is that you get to leave column B on page 2 of the 1094-C blank. You don't have to provide the monthly full-time equivalent, full-time employee count. And the IRS, I guess, doesn't need to know that, because you're not going to be subject to the big penalty. So they don't need to determine your total number of full-time employees. You're conceding you're a large employer, but you're saying, look, I hit at least my 70% in 2015 or 95% offer of coverage requirement. That's all the 98% method gets you out of. You still have to do everything else. The other two that might apply are the qualifying offer method relief and the qualifying offer method transition relief. These would apply if you offer minimum value coverage that is affordable using the federal poverty line safe harbor to employees for all 12 months of the year. If that occurs, what you're allowed to do is, when we flip over to the 1095-C, I'll show you in a minute, For those employees who were offered qualifying minimum value, federal poverty line, safe harbor coverage all 12 months, you don't have to report the cost of that coverage to those individuals because you're staying as federal poverty line affordable. And if you want to, you can give those employees an alternative form telling them essentially what happened during the year rather than giving them a 1095-C. Now, recall that the 1095-C is really given in two places. You give one to the employee and give one to the IRS. You still have to give a 1095-C completed to the IRS. You can leave that affordability line blank, but you still have to give it to the IRS. And let me just show you quickly what this looks like. So here's the line. Here's the big lines here, 14, 15, and 16. You get to leave line 15 blank if you qualify for that relief, but you still have to give this form to the IRS. You don't have to give it to the employee. You give them a statement that essentially says you had qualifying coverage all 12 months, but you still have to fill this out. So again, my perspective is you're already filling this out for the IRS. Is there really that much of a benefit to this transition relief, other than leaving this column blank? I don't know. I don't know that there is. There's a separate form of relief called that's the qualifying offer method, and that's for any individual who had qualifying minimum value, affordable federal poverty line safe harbor coverage for all 12 months. If you have 95% of your employees who meet that threshold, 95% of your full-time employees who meet that qualifying offer threshold, then you might qualify for the qualifying offer method transition relief, which sounds very similar. The distinction is you still get out of this line 15 for anybody who met that requirement and had that qualifying coverage. And then for these purposes, for filling out line 14, you essentially use a code 1A for any month in which the individual was offered coverage, and I think it's a 1L for any month in which they were not offered coverage. And I'll pull out the instructions and confirm that piece. But essentially, you still have to give the 1095-C to the IRS. So again, query how valuable this form of transition relief is. I don't know that it's that great. Obviously, if you qualify for it, I would suggest you take advantage of it. But it's not an end-all, be-all. It doesn't get you out of reporting entirely. And by the way, you still have to give the 1095-C if the individual didn't have qualifying coverage all 12 months. So that's the 1094-C, and those are the forms of transition relief you might qualify for. Signature line, sign off. Somebody asked who signs that. Not really clear. You'd probably look to who signed your W-2 for guidance there. Part 3 of the 1094-C is monthly information regarding whether you offered coverage. So essentially you're saying whether you offered minimum essential coverage to at least 95% of your employees by month, and if you did it all 12 months, you obviously just click all 12 there. But if you didn't, then you would click no for whatever that month is and split it out by months. Even though the threshold is 70% in 2015, the threshold for clicking the box here is still 95%. Full-time employee count, column B, that's, it is what it is. That's, you count up your full-time employees and list them there. Column C is your total employee count. There's probably a simple answer to this. I'm not quite sure why the IRS is asking for that information, but you do list your total employee count under column C. For any month in which you were in control group, you would click the aggregated indicator code. And then for any month in which you qualify for that 4988 transition relief, which again, remember, is box D up on the first page, then you would put a code in here saying what kind of transition relief that is. So it's either the 50 to 99 relief or it's the off-calendar year relief. And then on the final page, you're required to list and report all members of your control group during the year, during any time during the calendar year. So this is a list of commonly related entities. That is the 1094-C, and I know we're getting to the top of the hour here, so I do want to hit on the 1095-C while we have a minute here. So that's the aggregate report. Now we switch over to the report that's provided on an employee-by-employee basis. First part, straightforward, information about the employee, information about the employer. Hopefully pretty understandable. Now, part 2 and part 3 are very, very important, and arguably, if you're the employer, part 2 is the most important part of them all. Part 2 is the employer mandate reporting, and you would fill out this part if you're an applicable large employer and are required to offer coverage. Part 3 is only completed, and you'll see this box at the top here, if you offered self-insured coverage. Part 3 is not intended for purposes of the employer mandate reporting. It's intended for purposes of the individual mandate reporting. So it's important to get Part 3 right, and you can be penalized under that up to $100 per wrong return if you fail to do so. But as I understand it, Part 3 should not impact your liability on the employer mandate. So you still do it if you're a self-insured employer. You still do it if you have an individual who's not a full-time employee who is enrolled in coverage. But don't worry too much about this one. Get it right, but the real liability comes with misreporting in Part 2. So Part 2 is only 3 lines, but arguably some of the most complex reporting easily that I've seen in my career, that I'm sure other folks would concur on that. So it really breaks down into 3 lines, and you'll see it's a grid. So the first thing I'll point out is that this is a monthly report. So each given month, as the circumstances change, the code that you use there might change. But if it is uniform all 12 months, you can just fill out the first column and you're good to go. Separately, you're going to see that it breaks down into 3 rows. The first row relates to the offer of coverage you made to that employee. You're essentially telling the IRS, yes, I did offer them coverage, or no, I didn't offer them coverage. And if I did offer them coverage, here's what it looked like. Was it offered to the employee? Was it offered to their dependent children? Was it offered to their spouse? Now, no, you don't have to offer spousal coverage, but if you do so, you have to report it here. Won't trigger liability, but you have to tell the IRS that information. So, again, was it employee, employee plus spouse, employee plus dependents, all 3? Second, was it minimum value in those months, or was it just minimum essential coverage? Third, was it affordable? And if so, was it affordable based on one of the safe harbor approaches for affordability? That is line 14 in a nutshell. If you qualify for the qualifying offer transition relief, the relevant code here would be 1A, and that's the easiest approach across the board. By the way, these are called the Series 1 codes because they all lead in with a 1. So it would be 1A, 1B, 1C, 1D, all the way through 1L. Line 15 is where you report the cost of coverage for self-only coverage for the lowest value, minimum value option. So it's not what they enrolled in, it's what they were offered in the lowest minimum value option. You're only completing this if you use codes 1B, 1C, 1D, or 1E. I realize that out of context that's hard to say, but there might be circumstances where you're not completing this box, and you might be able to just fill out all 12 months unless the cost is changing. Now again, it's the cost for self-only coverage because that's what's relevant for the employer mandate. Finally, line 16 is arguably the most important line on this entire form because this is where you tell the IRS either they enrolled in the coverage so I'm good, or they didn't enroll in the coverage, but here's why you shouldn't penalize me. So if you don't focus on anything else, absolutely focus on this line 16 because this is going to tell the IRS whether to assess a penalty. So the codes that you would use on this line 16 essentially are codes that say they weren't my employee at all. They weren't my full-time employee. They were offered coverage that was affordable, but they waived that coverage. They were in a multi-employer plan, so I qualify for multi-employer plan transition relief. They terminated coverage mid-month. Here's a big one. They were in a limited non-assessment period. I think that's code 2D. And what that means is you hire somebody and they're either in the first 3 months of employment or they're a variable hour employee and they're in their first 12 months of employment. So if they're a variable hour employee in their first 12 months of employment, up on line 14, you're not going to be telling the IRS you offered them coverage because they haven't qualified yet. You're going to be using a code that says they weren't offered coverage. So if they weren't offered coverage, it's very important that you tell the IRS in line 16 why they weren't offered coverage. And there it would be a 2D. You told me the IRS told me that I didn't have to report, I didn't have to offer coverage for the first 12 months for a variable hour employee. So I'm using that code. Please do not assess a penalty against me. So again, can't stress enough the importance of these 3 lines and specifically line 16 because you've got to take a defensive posture when you're doing this. Obviously, you report correctly, but for any month when you didn't offer an individual coverage, you better be telling the IRS why. Otherwise, you're conceding to the IRS that you're subject to a penalty for that month if that employee enrolled in the exchanges and received a tax credit. So that's line 14, 15, and 16. Boy, I'll tell you what, I've spent with certain clients hours and hours and hours walking through what the codes are and how they work and when to plug them in and how they work with each other. We don't have time for that today, so I'm just going to say focus on those 3 lines above all else. and start early and try to get it right. Final part three is, again, not tied to the employer mandate. It's tied to the individual mandate. If you had a self-insured plan, you're telling who was enrolled in that plan, both the employee and any qualifying dependents. You have to report their Social Security number. If you have it, you have to ask for it at least 3 times. Once at the end of the year following their hire, once at their first open enrollment, and then finally at the end of the year following their hire. So if you can't get it after those 3 solicitations, you can use date of birth. And then again, you're reporting, checking the box for any month in which they were enrolled in even a single day. By the way, it's not confusing enough. Contrast that section where you're reporting if the individual was enrolled even a single day with this part 2, where you're only reporting if they were enrolled for the entire month, subject to certain exceptions. So up here, generally, only if they were enrolled the entire month, subject to certain exceptions. Down here, reporting if they were enrolled even a single day. Those are the forms. What I would say here is that these are going to be really complicated, and regardless of what your strategy is, if you're going to handle it internally, if you're going to outsource it, please start now. We have some clients who have been working on this for over a year now to get ready for this, and they're still not ready. You got to have these by, by January of 2016. So if you don't start now, you're going to be left behind. They're extremely complicated, exponentially more so if you have a large workforce with a lot of things happening, people coming in and out of coverage, and new hires and terminations throughout the year. So start now, get focused on that, and go from there. I don't know what to do at this point. Jenny, I think that we probably have we have a billion questions here. I don't know if we have time for questions. If you want me to try and take a couple of these, if we need to wrap it up here, let me know your preference. And while that's happening, I'm going to take one that go ahead, Jenny.
Hi, Ben. Yeah, I think we do have time for a few questions in light of the many that are being asked.
Yeah.
So we'll go ahead and take a few, and then I'll let everybody know on the call if we don't get to your questions. We may also be able to try to email you some answers to try to give you some clarity. Those of you that are certified healthcare reform specialist participants will, of course, be able to gain a little bit more clarity through the continuing education modules. So Ben, let's go into the questions.
Yeah, sure. So I'm gonna grab a couple of these if you don't mind, based on
yeah, that'd be great. That'd be great.
Yeah. So one is who files the 1095-C for union employees on a self-funded plan? If the employer sponsors the plan, then the employer is, well, okay, let me say this. The employer is always filing a 1095-C for that individual. If they're your employee, you have an obligation to tell the IRS, yeah, they were my full-time employee, and I did or did not offer them coverage, or it was offered through another plan. Regarding that second part of the form, the part 3 of that form, this is going to vary based on whether it's a multi-employer plan or an employer-sponsored single-employer union plan. If the employer is the sponsor of the plan, the employer is required to complete this form. If the multi-employer sponsors, if the employee is enrolled in multi-employer plan coverage, then the union, the multi-employer plan, would issue a 1095-B telling the employee about the coverage they were offered. So it's similar to an insured plan. You as the employer are still obligated to fill out part 2, but the individual or the provider of that coverage, be it a union plan or an insured plan, completes a 1095-B telling them about that coverage. Now, the coding for multi-employer plans is very, very complicated, so I encourage you to get ahead of that one as well. There's a special indicator code for multi-employer plan transition relief. The transition relief itself is extremely complicated, so I won't linger on that for the folks on the call, but just know that that piece is pretty complicated. Transitional relief is very confusing. How do I know whether these apply? Do you have anything in writing? I guess what I would say is the instructions for the 1094 and 1095-C are available online. They're not long. I mean, they're only about 14 or 15 pages, and they do outline in 3 relatively succinct paragraphs how those forms of transition relief work. I don't know that that's going to make it any less confusing. I'd encourage you to work with your health insurance broker, consultant, or legal counsel to work through how those forms apply. And by the way, if you qualify for the transition relief, that doesn't mean you have to do the simplified reporting. You can still do the full reporting. So if you think there's any question as to whether you qualify, there it is. What is the maximum amount of employee contributions considered to be affordable? We have a whole other presentation on the employer mandate and how that works. Generally, there are 3 different safe harbors you can use, and even if you don't qualify under one of the safe harbors, as long as it's not the premium for self-only coverage, the employee premium for self-only coverage doesn't exceed 9.5% of household income, that would still be considered affordable. The federal poverty safe harbor, which is the easiest one to determine, generally breaks down to about $92 a month. And I think you're throwing out the figure here of $1,100. That might be $1,100 annually. That sounds about right to me. But just because it's above that threshold does not mean it is unaffordable. Does any of this affect employee groups under 50? I think the term employee group there is a bit imprecise. So if you are an employer who is a standalone employer, not a member of a controlled group, and you have a fully insured plan or no plan, there's no impact. That's the narrow circumstance when it wouldn't apply. But if you're a small employer but you're in a control group, you're still subject, that's above 50, that you're still subject to this. If you're a small employer and you have a self-funded plan, you're still subject to this. There are a number of instances when this might apply. Criteria for alternative reporting, I think we walked through that in quite a bit of detail in the presentation, so I'm not going to rehash that here. I think, Jenny, I'm going to pause there. A lot of these get more specific into narrow circumstances that might not apply more broadly. So for the sake of time, because we're over, I'm going to pause there and turn it back to you.
Ben, thank you so much. It's a lot of material to cover in a short period of time, and I would encourage those of you that have not had an opportunity to take the course to contact me. My number is 561-790-1176. You can speak with my associate Miguel Dorsan at extension 802 or myself 810. We'll be happy to walk you through the program and help you understand it better. And Ben, we just can't thank you enough. Thank you for taking the time. We know you're very busy, and we really do appreciate your insight on this. And for those of you that did not get your questions answered, we'll do our best to try to get you some clarity. And thank you so much for joining us today, and have a great rest of your afternoon. Thanks. Bye-bye.